Hi, my name is Fiona Kinsella and I'm a clinical specialist physiotherapist in neurosurgery. I work with adults who have had surgery for the management of a brain tumour. I am going to share some top tips on how physiotherapists can support people to optimise their function and improve their mobility following the diagnosis of a brain tumour. Brain tumours can have a wide range of effects on mobility and function. As a healthcare professional, it is important to understand the brain tumour diagnosis that an individual has received. While some brain tumours are malignant, many are benign, and understanding the diagnosis and surgical or oncological input received to date is integral to guide rehabilitation interventions and goal setting. If you are unclear regarding the pathology diagnosis and its consequences, consider contacting the individual's medical team or referral source for guidance and care, as this information will be able to help you to plan your interventions. Of note, the National Specialist Neuro-Oncology multidisciplinary teams are based in Beaumont Hospital, Dublin, Cork University Hospital and Galway University Hospital. It is also very important to explore the cerebral location of an individual's lesion in order to anticipate or correlate the physical impact of that lesion. For example, a frontotemporal lesion could impact the motor strip, and this would result in subsequent muscle weakness. A lesion in the parietal lobe of the brain is commonly associated with unilateral neglect or inattention, which can often be misinterpreted as weakness, whilst a tumour of the cerebellum or posterior fossa is more likely to present with balance and posture changes. Understanding the tumour location as well as the pathology and treatment interventions to date will be very important to guide your assessment and intervention for this individual. A thorough clinical assessment will help to identify the individual's impairment level. A full neurological assessment involves assessing power, sensation, tone, coordination, balance and mobility. Understanding the exact location of an individual's brain tumour will allow you to prioritise elements of this assessment as needed. It is important to understand the person's level of cognitive function, visual processing and fatigue, as these factors play a big role on how safely someone can move and engage with your assessment. As always, it is beneficial to use standardised outcome measures such as a timed walk for mobility or the Berg Balance Score or modified CAT-SIB for balance in order to review and assess changes in functional status. Encouraging mobility is important to prevent secondary complications such as deconditioning and pressure-related injuries. It's important to get the body moving in a way that is safe and will build an individual's confidence. Sitting up, standing and transfer practice should be encouraged to promote movement. The use of aids and supports are welcomed to promote safety and to facilitate higher levels of function. Considering an individual's pre-diagnosis activity and functional levels is important to tailor their programme and optimise their return to pre-morbid function. Exercise guidelines for adults with brain tumours are the same as the general population, as advised by the American College of Sports Medicine. The brain has an incredible ability to adapt, and the body has an impressive ability to compensate. Where possible, monitor postures and patterns to promote and encourage symmetrical alignment and movement. Encourage movement repetition, task-specific training, and exercises that are both functional and engaging. Whilst the use of general core strengthening programs such as Pilates can be really beneficial, ensure all exercises are progressed to provide a level of challenge that will promote strengthening. Encourage standing exercises and promote functional movements such as backward walking, lunges, things that target the different elements that contribute to gait. Consider the ACSM exercise guidelines in all elements of exercise prescription. Work with the individual to identify what is important to them. Set short-term goals that contribute to longer, more meaningful goals. It's important that goals are realistic and meaningful at an individual level. The use of a tool such as the goal attainment scale can be really beneficial in this instance. Mobility rehabilitation needs to be monitored and advanced over time. Remember that symptoms in this population can fluctuate. Keep communication clear and consistent, especially when it comes to safety, equipment and goals. Liaise with families and others who give support as needed, and do consider contacting other healthcare professionals for guidance. Every person's journey with a brain tumour is unique. However, with thoughtful, person-centred assessments and treatment, we can help people with a brain tumour to regain and improve their mobility, confidence and independence.